You're 65 and you're eligible for Medicare. But even if you don't need the benefits, you still have to enroll. Why is that? Well, our Medicare and health insurance experts are here to explain why. Catherine Sevier from AARP, Steve Edmonds from Alliance Insurance Services are the experts taking your questions today. So what we want you to do is text in your questions to the number on the screen, 336-379-5775. All right, Catherine, first and foremost, let's just start off with that. Everyone needs to sign up for Medicare. Let's talk about the timeline.
So the timeline is always the same for all of us. 3 months before our 65th birthday, the month of our 65th birthday, or 3 months afterwards. And it's critical, even if you're still working and you have the best health care insurance in the world, you still have to sign up. And you have to let Medicare know that you are there, and they will immediately put you into the system.
Okay, so we saw the timeline there. We said, you heard her say everyone has to sign up. Steve, let's talk about why everyone has to sign up. What happens if you don't sign up at 65?
So the government can impose and will impose penalties on you, and the penalties come from your Part B of Medicare, and they also can come from Part D of Medicare, which is the drug coverage. And the penalty for drug coverage is generally 1% for every month that you go without coverage. And then Part B can be up to 10% penalty. So, and those can be quite large, if you wait a long time before you do sign up. So you do need to be aware of that and just be ready when you get 65 to get that done.
Okay, and so we want to make it really clear, everyone, and that's everyone, whether you're still working or you're not working, or you get insurance from your spouse or whatever, everyone at the age of 65 has to sign up for Medicare. Otherwise, you're going to get that penalty, and that penalty lasts the rest of your life. Hey, Catherine, let's talk about that Part B specifically, because if people are working and they have insurance that meets the criteria and they don't do that Part B, what do they have to do? What should they be looking at for the box to check or whatever to make sure that they do it right?
So they can defer the payment or the enrollment in Part B, but they have to prove that they have a credible insurance policy that is active. The best thing they can do is check with their HR department or whoever does their insurance there, so that they make sure that it meets the criteria, and then they can check that box, and that keeps them from having to make a payment for Part B until they need it. Now, once they retire from their work, they have a limited period of time in which they can sign up and must sign up, or again, you're going to be hit with penalties.
Okay, let's talk about the different kinds of Medicare, because there's all these different kinds. There's A and there's B and there's D and all that kind of stuff. So Steve, kind of go through the 101 on what each one of those does.
Okay, so basically you're going to be hit with 4 parts of Medicare. You're going to see a Part A, Part B, Part C, and Part D. CMS and the Centers for Medicare, they're big on these letters. So Part A is your hospital coverage, and it's free. You don't pay a premium for it, and but all it covers is hospitalization. Then you have Part B, and that is your actual medical coverage. That's the big one. That's where you use a lot of coverage, and you have a lot of claims on Part B. And that's stuff like your doctors, any healthcare workers are paid from Part B, diagnostic testing, scans, imaging, durable medical equipment. Part B is huge, and they do charge a premium. It's $174.70 a month for your Part B. Then Part D is your prescription drug coverage. Medicare doesn't cover that at all, so you have to get your drug coverage through an insurance carrier. But again, it's very important to get that, and the price can vary on Part D according to how good or how bad a plan that you pick out and choose to go with. I skip Part C. We'll go back to it. So Part C is a Medicare Advantage plan, and that's where you take Part A, Part B, and Part D, and you combine them all together into one lump sum package plan. and that is what you buy through an insurance carrier. And then the insurance carrier takes care of doing your claims and providing your coverages and giving your prior authorizations. And that is what we call Part C.
Gotcha. And you said that is also, what's the other name for that?
Medicare Advantage.
Advantage. Now, Medicare Advantage and Medigap, are those two different things?
They're absolutely different. And you can go either way. A Medigap policy is going to be your best and most robust medical coverage, period. But it's going to be a little more expensive. At age 65, it's generally going to run a person probably anywhere from $120 to $135 a month premium for that. A Medicare Advantage plan is typically going to be a zero premium. And it's going to include stuff like dental and vision and hearing and over-the-counter products from your drugstore. But you're going to have a lot of copays with a Medicare Advantage plan. A Medicare supplement or a Medigap policy is generally going to be 100% coverage. A Medicare Advantage plan, you're going to be hit with copays all throughout the year. So it's just, it's different strokes, and it's just whatever you want to pick out there, but both are good plans.
Okay. Really quick before we go to break, Catherine, this person says, can I sign up 6 months before I turn 65?
Nope. 3 months before to 3 months after.
That is what the government has set up, and so we can't do anything about it. Neither can the insurance companies. That's what the government said they're going to do. All right, we've got some questions. We're going to be taking those in the next segment. Get your question in, 336-379-5775. We'll be right back.